Good morning. Hi, this is Babak, Larian, doing a Facebook Live video session on parotid and salivary gland disorders. Started a few minutes late, unfortunately. Even being quarantined at home still lends itself to being late. I apologize. In any case, I hope you're all well and your families are all healthy. And I'm going to go ahead and start the session. I'm going to start by just going through the basics because the first question we had was about salivary stones. So let me actually bring the there we go. So the way the salivary glands function is that they produce saliva. So this is the parotid gland, the largest salivary gland, but oddly enough, it is not the most productive salivary gland. I'm going to change location. This is the submandibular gland, right? Which is not quite so large, but the great majority of the saliva is produced by this gland, the submandibular gland. The parotid gland has a duct that opens up into the mouth like this. The submandibular gland has a duct that opens up into the mouth in that fashion, right? And so if we were to look, the saliva that's being produced is, sorry, touched the wrong button, but let's get back to the parotid glands. Technical problems. Any case, so again, when saliva glands produce saliva, you can see smaller amounts of saliva. This is called the sublingual gland. Here on the back of your lip, if you look at their bumps on your palate, there are little bumps on the back of your throat, there are bumps. All of these are producing saliva on a continuous basis, right? So saliva production is obviously very important and very significant to the normal functioning of the mouth. And because of it, on a daily basis, we make anywhere between 1.5 to 2 liters of saliva. That's one of those big, huge soda pop bottles. That's how much saliva we make during the course of a day. And that's very important because it's such an important function. It slowly grow in size to get bigger and bigger. They can be in the duct, the main duct, or they can be in one of the offshoots. So if you were to imagine that this is the duct of the submandibular gland. It comes into the gland and then it divides up into branches. And these branches divide up into more branches. So a stone may form in the main duct, or it may form in these smaller systems, all right? It can occur anywhere. There was always the concern that the stone is based on your blood calcium level. But there's no correlation between blood calcium level and stone formation in the salivary glands. It has actually more to do with the level of hydration. So it's how much saliva is flowing through it. So we're gonna mark saliva as yellow, right? It's how much saliva is going through that controls the potential for stone formation. The more flow of saliva, the less likely it is for there to be a stone because it washes away everything. The best way to assure more saliva flow is actually by drinking lots of water so that the saliva that you make is thin and can get through very easily, as opposed to sludgy and like a gel that gets stuck in a small duct more easily. So people who form stones in their ducts tend to have some history of not hydrating as well as their body's needs are, and as well as the demands that their body has. So that's the main reason for the stone formations. Now, there's ways to address the stone formations. There are ways of getting the stone out. If the stone is in the main duct here, let's do it in black. Then you can put a camera that goes through here, sees the stone, grabs it, and pulls it out. But if the stone is in the smaller branches inside the gland, then the camera cannot fit into those smaller branches inside the gland and get it out. So the stones that can be removed endoscopically, you could say. We call it endoscopy, right? But the stones that are inside the gland, the camera cannot reach it, the scope cannot reach them. So those stones, if they're causing problems, have to be removed through other means. In any case, that's the basics of the stones. So I'll go ahead and move on to the next question. Lisa's question, which was, is hyperparathyroid disease connected to stone formation? It isn't. People who are hyperparathyroid have extra calcium in their bloodstream. They have a huge formation of calcium in any part of the organ. They're predisposed to getting kidney stones, but there is no connection between that condition and salivary stones. They're very independent. I have a feeling that even though they may not cause it, if a person has hydration issues and it has hyperparathyroidism, has extra calcium in their bloodstream, if they don't hydrate well, then they're more likely to get stones, or if they already form a stone, they're more likely for those stones to get bigger because there's so much calcium available everywhere now. But I don't think that's a cause of it, but that's a contributing factor to making it worse, potentially, okay? But I'm not saying that's based on any research, this is just based on my clinical observation, all right? The next question is by Aaron Harkness. Can you answer any questions of Rathke's cleft cyst or pituitary tumor? Thank you so much and be well. I'll say as much as I know, Aaron. It is not my area of specialty, and it is, let me show you. So, right underneath the brain, let me flip this again. Okay, so right underneath the brain, there is a gland called the let's see, pituitary gland. The pituitary gland sits right underneath the brain, and it is separated by anterior pituitary and posterior, right? And between these two, it's kind of a pouch. It's called the Rathke's pouch. And that can fill up with stuff, which will give you the Rathke's cyst, right? And it can get bigger as it fills up with stuff. These glands also can form tumors in them, right? And so these tumors can be hormone producing or can be dormant or silent. And so that's where it happens. Most of the time the cysts are obviously not tumors, and they're just adding more fluid compression of the glands, so they make the functioning of the glands be less effective. And that's really all there is to it. So that's about all I know. You do actually need to speak to a brain surgeon to get more information and better information about this. All right? So let me move on. Hopefully, Aaron, that helps. The next question is from Brad Johnston. Hi, Dr. Larian. I'm from Chicago and was scheduled to have a parotidectomy on March 20th, but it was delayed due to COVID-19. The MRI and, sorry, I'm trying to look at the iPad. The MRI and biopsy showed a likely benign mass. However, there was some atypical cells. Since January, the mass has changed in size from very small to then close to a golf ball, and now is very hard to the touch. Should I have any concerns on the surgery being delayed, and would you have an idea of sense of urgency when it should be rescheduled? Brad, benign tumors generally are slow in growing. If this tumor is growing faster, then its behavior is suspect. The fact that you have atypical cells on there, that the gland is growing faster and now has become more firm, is concerning. I can't say with certainty that this is cancerous, but I can say that if you were my brother, I would insist that you have your surgery significantly sooner. And I think if you communicate these changes to your surgeon, they will change your surgery time and get you into the operating room within the next few weeks. Based on what you're saying. Now, once they examine you, they may find something different and so on, but the description that you're giving me, Brad, about what changes you're feeling makes me believe that the tumor is changing its behavior, and it does require more attention more quickly. So I would do it right away, right? I would pursue it right away. This All right, let's move on. Moving on. Now let me flip this around and show you some slides of tumors, since Brad is now, again, 80% of parotid tumors, 80% of salivary gland tumors happen in the parotid. Of those, only 20% are cancerous. So when there's a lump in the parotid gland, only 20% of times that lump is cancerous, right? Which is really good. Of the benigns, there's 15 recognized by the World Health Organization. One of them, which happens to be the most common one, pleomorphic adenoma at 72%, is the one that has the potential of becoming cancerous. The remaining ones either have no potential at all or very little potential, less than 1% potential kind of a thing. Whereas pleomorphic adenoma has a much higher potential of becoming cancerous and needs to be addressed. Now, moving out to the cancers, there are many different cancers, right? And some are very aggressive and like malignant malignant mixed tumor, which is a pleomorphic adenoma that has transformed into a cancer, squamous cell cancer, adenocarcinoma, high-grade mucoepidermoid carcinoma. These are very aggressive cancers and grow rapidly, while actinic cell carcinoma, low-grade mucoepidermoid, myoepithelial carcinoma. These are slow-growing cancers and tend to be somewhat low-grade. So the treatment for low-grade cancers and the high-grade cancers is different. The amount of time you have in order to start treatment is different. Yeah, obviously the high-grade cancers, you want to get on it sooner before it has a chance to affect the facial nerve. The lower-grade cancers give you a little bit of time so you can figure out who is the right surgeon for you and what is the best situation for you to work in. And those are the basics of the cancers. The most important thing I would say when you have a mass is to, is to do a needle biopsy, right? So if this is the tumor, this is the needle that goes inside the tumor to get a piece of it so we can tell. And this is the reporting system for salivary gland tumors. It's called the Milan system. And the Milan system is important because it gives you the risk of cancer. So when they say malignant, more than 90% of the time they're correct. Once they say it's benign, less than 5% of the time there's a cancer hiding there. So knowing these risk categories is very helpful and very important. And so during this time of people being in quarantine, it is really important that if you have a mass, you address it appropriately. You try to figure out which category you fit in and take action appropriately. And the best way to do that is to do a needle biopsy, right? Generally, benign tumors are mobile. So if you have a mass in your parotid gland, and the parotid gland sits right here, if they're mobile between your fingers and move it around, right? If it's not painful, if your facial nerve is moving, so it means you smile and they're symmetric, you raise your eyebrows, close your eyes tightly, all those things are functioning appropriately, then you have a facial nerve system that's functioning appropriately. So if your facial nerve is moving, if you're not having pain, the mass is mobile and not moving and not growing rapidly, you can move it between your fingers and it's not attached to the deeper tissue, then those are good signs. They're not 100% certain, but they're good signs. And so if you have symptoms that are outside of that, if you're having pain, if you have one of the facial nerves that are not moving, so when you smile, it's not symmetric, this part doesn't move, or if it's growing rapidly or it feels like a knuckle, as hard as a rock, then those are bad signs. Those are signs that things could be more serious. Not 100% certainty, but very, very good indication that things are turning the wrong way. And so they require attention. So if you are sitting at home and have any of these concerning signs, I would urge you to contact your doctor and get on it quickly, because you can make a difference. The sooner you diagnose a cancer, the better chance you have of beating it. Let's see. And that's it. During these times where we're in quarantine, it's hard to access healthcare, but I think this is when you need to be an advocate for yourself and be able to go out and